Welcome back to section 3 of pharmacology, where we'll be discussing nitroglycerine and naloxone. Nitroglycerine is a nitrate prescription medication given to those patients who had history of angina pectoris. It is an EMT assist medication to those who are currently experiencing symptoms of angina and those who have the medication on them. So what is angina? Angina is temporary chest discomfort which arises due to decreased oxygen supply to the heart, where the demand is more but the supply is not being met with. That can happen due to a coronary artery spasm, a partial obstruction, or a complete obstruction. If the spasm and the obstruction is not relieved, the tissue can eventually die, leading to myocardial infarction. So how does nitroglycerine help? Nitroglycerine has two effects. It causes the veins to dilate. If the veins dilate, there will be decreased venous return, which will cause decreased cardiac output. Decreased cardiac output means decreased workload on the heart. Decreased workload means decreased demand for oxygen. Second way it acts by dilating the coronary arteries. By dilating the coronary arteries, they increase the blood supply to the heart tissue, thus increasing the oxygen supply. But there's one major side effect of nitroglycerine that we have to remember. Decrease in venous return causing decrease in cardiac output means that the patient will have hypotension. We cannot administer this medication unless we have a systolic blood pressure minimum of 100 millimeters of mercury. The patient will very often complain of headache, another major side effect of this medication, which is why many patients do not like to take nitroglycerine because of the constant headaches that they get from the medication. Another interaction that we need to remember is that with other medications which have the similar mechanism of action. Medications which are used for erectile dysfunction are also venodilators. Together, both of them will cause significant hypotension, which can be fatal to the patient. What are the routes of administering nitroglycerine? You can either get it in a tablet form or in the spray. One spray equals to one tablet dose. Both are the same. The tablet is given sublingual and the spray is either given, mostly it is given through the nose. After we administer one spray or one tablet, 5 minutes later, we need to do two things. We need to document the change in blood pressure and we need to document the change in the patient's pain level. If the blood pressure is still holding above 100 and the pain is not reduced, we can give one more tablet of nitroglycerine to help the patient. So this was all about nitroglycerine. The next section we will talk more about Narcan.